Navigating through the COVID-19 pandemic has been unlike anything we've experienced in modern times. This global health crisis presented unprecedented hardships for families, but also presented an opportunity to expose racial disparities related to healthcare, education, employment, and food insecurity, which disproportionately impact the African American community. Consider this. During the summer, children are out of school for 72 days. But the COVID-19 pandemic forced schools to close for an additional 90 days. For the more than 94,000 students in Southeastern Virginia and the Eastern Shore who receive free or reduced-price lunch, many from predominantly African American neighborhoods, this means 162 days without access to healthy and nutritious meals.
Shopping for food definitely looked entirely different for my families because, my kids were going to school, they ate breakfast there, they ate lunch there. Sometimes, if they were involved in extracurriculars, they get an afternoon snack. And then, I would come home and cook dinner. And now that's not the case. I don't get SNAP benefits. And there's been times where I've had to crunch on a budget to make sure my kids, get their daily recommended amounts of healthy foods. And trying to do that on a budget is it's definitely a couple balls to juggle in the air.
African American students hit the hardest by food insecurity are expected to perform at the same level as their counterparts. Studies show that proper nutrition in a child's early years increases cognitive development and the ability to learn throughout the educational journey. As part of our mission to eliminate hunger, the Foodbank of Southeastern Virginia and the Eastern Shore is committed to amplifying the devastating consequences of food insecurity and inequity for children in our region. Let's reimagine a hunger-free community where every child has access to healthy food to grow and thrive.